So what was your most memorable experience serving as president?
Well, it was an exciting time. First of all, I started out as a board member and then a secretary treasurer and the president, and things were a busy year. One of the most interesting things, though, was when I was invited to be on Good Morning America with Joan London and talked about hair transplantation and the new drug that was on the scene then, Rogaine. So that was a lot of fun.
What were the issues facing the society during your presidency?
Some of the major issues were we were still doing some battle with the other specialties that didn't want dermatologists doing dermatologic surgery, and so we had to do a lot of our own education, but we did get some really good people to help us out. Galen McCullough from Alabama and a Dr. Webster. Galen was a head and neck surgeon and Webster was a plastic surgeon to work with us, and so we then started getting more of our own courses on dermatologic surgery, getting more involved with the academy, and raising the level of what we did and really showing the public, showing the other specialties that we were good surgeons.
What were the most significant innovations in dermatology during your year?
One of the first real innovations was laser surgery just started becoming popular with Len Goldman in Cincinnati, and some of us started going there and learning he has initially the argon laser and then the CO2 laser came along, and so this was some of the innovative thing that's really changed the way that we did surgery. Instead of just cutting or burning, we started using newer technology to enhance our practices.
Do you have a most memorable patient?
I think a young woman in her 20s that had several skin cancers, and I did a surgery on it and then did reconstruction with a really nice result, and we did a TV interview on this, and this really was probably one of my most interesting patients. I had a lot of other ones, though, patients that have become like family over the years now.
In looking back at your career, is there anything that you would have changed or done any differently?
Well, I think one of the things I would do differently is maybe spend more time visiting other specialists and spending time in their practices, learning more from them. It's one thing to learn it in a lecture or in a book, but when you see somebody work, I spent a lot of time with my good friend Dr. Neil Swanson and other people, Ted Tromovich and Sam Stegman, who were leaders in the field not only of doing skin cancer removal, but really innovated what we did as far as a reconstruction. So spending more time with other experts in the field, gleaning from them, and developing those networks.
What advice would you give today's young dermatologic surgeons?
Well, stay focused and be thorough, because my professor used to say, Ceilley, you can't always be brilliant, but you can always be thorough, because that's a choice you make. Keep up to date with the new technologies. Develop a niche so you can develop some level of expertise that will give you a lot of opportunities over your career. So I think that's something that's very important. Embrace the new technology that comes along.
What are your predictions for the future of the specialty?
Well, I think that things are going to change in the way that we're going to see more in the way of medical innovations, where I think we see more targeted treatment using genetics and immunology, and a lot of the things that we're doing surgically right now. They may laugh at us a few years, decades from now, and say, "You actually cut these things out." They have smarter ways of doing it. I think you're going to see newer and better light-based technology, and we're going to see more of us using multiple modalities to treat the same type of problem.
Do you have any advice for the ASDS leadership in serving its membership in the future?
Well, number one, keep up the education that we do, not only at our meetings, but on our website and other interactive things that we have. Keep in touch with the membership and give them practice support. Some of the other societies have lost track of that, I think, and ASDS has done a really good job of that, so I'd like to have them keep doing that. And also some of the advocacy that we're doing now in relation to skin cancer, other things. Those are the three most important things that I think.